most famous physical therapist on the internet.
Oh, hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today we're going to show you how to significantly relieve pain in 15 minutes, scientifically proven, no medications, and you can do this at home.
That's right, Bob. And
The
this
privacy
is
of your own home.
yeah, this is something that anybody can use sometime. And if you have children, you're going to use it more to help them out. So, what
Even
else?
the elderly, too.
Oh, yes.
All right. By the way, if you're new to our channel, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. Also, yes, indeed, you're going to want to go to bobandbrad.com and go to the giveaway section because this week we are giving away a beauty.
Oh, yes.
I'll talk about it in just a minute.
You bet.
You can also find it on Bob and Brad Facebook.
Yes.
It'll be pinned to the top of the page, the contest that is. Want a short version of us, go to Instagram, Twitter, or TikTok.
TikTok.
So this is the giveaway. We're giving away a Renpho massager. This is a wonderful massage gun. If you're talking about pain, this thing would work well for that too.
Oh, right. It's just another tool.
So it's got, I don't know, how many heads? 6, I think. 6
Yes,
different
1, 2, 3,
heads.
4, 5, 6. Yep.
And what is unique about this one, look at this, it adjusts.
Yeah.
So
different-
it's easier to get underneath, you know, depending, like you like to do it on there.
for my pectoralis
Yeah.
major, the
But
hamstring.
if you put it like this, you can get underneath into your hamstring
right,
or buttock.
Right.
And it's got 4 settings of intensity. And this will get humming. It's got good percussion.
Right.
So
It gets deep. There's no
keep
doubt
hitting too many
about it.
buttons. There we go. It gets deep. Okay, Brad.
Pain. Pain. Everyone experiences pain. We all want to get rid of it one way or another. And one thing we would like to avoid is pain meds,
Right.
opioids, things like that. So we got some research that clearly states significant improvement by using cryotherapy, in other words, cold packs.
I thought you were going to make me cry, Brad.
Well,
Like I'm
Bob,
supposed to
I'm
cry and I feel
passionate
better?
about.
Okay.
I'm passionate about this because I really think there's a lot can be done to decrease that and make our lives better. So we've got some science here.
All right, let's go to science.
Yep. So here we've got 3 studies, and there's actually a couple more we're going to mention, but these 3
Are
used.
we okay, Mike?
Yeah.
Not too much.
They use
glare?
cold packs for treatment, and this one after back surgery. They studied people who had back surgery without cryotherapy and morphine, and then some with cryotherapy and morphine. It was clearer and a significant decrease in morphine with the people who used the cold packs.
You put morph.
Well, I ran out of space,
I thought
Bob.
it was morph from orc.
Bob, why, Bob?
Well,
Another
people
one.
are going to know mork from orc, right?
If they're 50 or
Yeah,
older.
yeah.
And then this study, 2017 again, knee that's arthritis, right? And that was a clear and significant decrease in reports of pain with people who use cold packs on their arthritic
I saw
joints.
a similar study. They must have maybe saw the same study or what, but this is a group of doctors.
Okay.
They were making recommendations for knee arthritis.
Oh, yeah, I know
and
what you're talking
yeah,
about.
they were recommending the ice pack.
Right. So
So-
again, the whole different venue. It's different than the surgery. We're looking at arthritis, different types of pain, and it's still
And
effective.
I have to be surprised, but I was surprised at that time because I thought heat would be better.
Yeah.
But it was actually
Yeah.
ice did a better job.
Yeah, it can be surprising.
Yeah.
Another study, same year, knee replacements. Now this one,
This
Bob
is
and
no
I,
surprise.
no surprise. We've worked with thousands in total knee replacements. In this study, they found out the people who use cold packs did not need as much, and it was significant opioid pain
In
medication.
fact, with some people who have knee replacements now, they actually send a ice kit along with
Right.
them, one of those ice flow kits.
Right,
Yeah,
it recirculates the cold water.
Right, so
And there
that-
were studies on that too. That is a really successful way to
Sure.
use cryo. There were some other studies that gave strong benefits of from ice,
fibromyalgia.
fibromyalgia, and reducing muscle spasm. The muscle spasm ones that's been studied for many years ago.
Yeah, that
actually.
doesn't surprise me. This one does a little bit too. I would think heat would be better, but
The study showed
it was
yeah.
ice.
There you
So,
go. That's why we do studies. Okay. So now that hopefully you're convinced that maybe you better get a cold pack in your house, you're going to say, why does it work? So
Sure.
and through the science and the physiology of it, we're not going to get into
There's
it.
a lot of reasons,
Right.
but we'll go over some of the three main ones.
If
here.
you're a therapist, part of the gate theory, there's
Right.
changes metabolism, vasoconstriction. But what it does in the bottom line is it increases the pain threshold.
So you can tolerate higher amounts of pain.
Yeah, it's just like taking a pain pill.
Sure.
The bottom line, that's what it does. It reduces muscle spasms. We mentioned that,
Right.
as well as the cold, like a balloon when it gets cold shrinks, your swelling in your joints or wherever the injury is, the cold can contract and shrink the swelling, which takes pressure off, allows healing better, and
decreases pain. But
Right.
swelling is actually part of healing.
right,
But the problem is the body goes crazy and it does too much of it,
right.
and it actually has a deleterious effect.
Wow.
I thought I'd throw in a word in there.
Excellent. He's been studying that.
Yeah.
Excellent. So now you're going to say, what should I use?
Right.
What kind of cold
Brad,
pack?
what should
Where
I
do I
use?
get one?
Where do I get one, Brad?
So the studies went into that as well. And what I liked about these studies, they studied things that you can use at home, as well as you can purchase, cold pack as well. But the first one is just crushed ice. You can put it in a Ziploc bag, put that on your knee or the injured area. And they did that actually on the study on the calf muscle. They put the cold pack of the cryotherapy for 15 minutes. They took it off and measured the temperature of the surface of the skin. Crushed ice was at 35 degrees Fahrenheit.
Okay, after they used it.
Right. And then they ice water with a bunch of ice in it. So you got an ice bath basically, submerged. 31 degrees was down 4
So
degrees.
it did better,
A
yeah.
little bit better. Now listen to this one. Now this is one that I have patients have used this because it's handy. Is simply you take frozen peas.
Wow.
And they're flexible so they can wrap around the joint a little bit
Sure.
or wherever it is. And they drop down to 26 degrees.
So even better.
Yeah, and you can buy these for like $1 a bag,
Sure.
These happen to be organic. I paid $2 for 'em.
Okay.
But
Good job, Brad.
yeah, don't eat them. Unless your mother-in-law is coming over, then pull them out. Just kidding. I can see that. I don't have a mother-in-law.
Burn.
They're passed away.
Yeah.
Gel pack. So this is a very common. Here's a small one. Here's a bigger gel pack. They actually did the best of these. There's one more that's better.
Right. Well, we actually have a link below for Eye Relief. They make a nice gel pack.
Yep, they
so
do.
If you want to buy one, you
Right.
can check that one
Yeah,
out.
we do
So,
recommend that one. That dropped it down to 24 degrees.
24 degrees.
Right.
So from 35 with the crushed ice down to 24 for the actual gel pack.
But wait, Bob, there's more.
There's more.
Yes. Not only did they study superficial temperature, the skin temperature, but they studied the temperature of the muscle below the skin.
Okay.
And what they did is they took the best one, the gel pack,
Sure.
and then they went for the holy grail, Bob.
Wow.
This is, everyone knows if you use direct ice, or you don't, we didn't know that, but we do.
Right. Now we know.
And it makes sense. If you take direct ice and put it directly on your skin and give a ice massage.
How did you make this?
Oh, that's a good question, Bob. I took a styrofoam cup. I filled it up, not full, but about 3/4 full, a little more. Put it in the freezer.
Sure.
Or in Minnesota, this time of year, you put it
Just
outside.
Put it outside. No kidding.
Let it freeze overnight. Peel away enough of the cup
top.
so you have exposed ice. And there you go. You got a sore knee.
Well, and
you,
again, I usually take my palm and smooth it
Ah,
out a little bit because there's some rough edges on
Yep.
there.
Yeah, and I'm tougher than nails.
Yeah,
Oh,
sorry.
my.
Yeah, he's from Wisconsin,
Yeah.
so they don't do anything.
No,
like
it is a
that.
good idea. I do that with my patients. I always make sure they're comfortable.
What's nice about it too is it actually calms it down a lot faster
Right.
than a regular ice pack.
Right, because they were doing 15 minutes. Now with this, typically I go 5 minutes.
Sure.
And you'll get
It knocks
at
it down fast.
Exactly. Now for this study though, they did go 15 minutes because they compared 15 of this, 15 of
They
this.
actually did it for 15
Yeah,
minutes. Wow.
yeah, and they said they normally don't do that
Sure.
in the clinic, but because of the study, they wanted to keep it even. You know what I'm saying?
Yeah, usually when you're doing this, you can take your fingers and hit with two fingers apart, and
Yep.
it feels like one. That means
You know it's numb.
You also get that little redness around
Yep,
the edges.
right.
That usually that hyperemia
It-
usually means
wow,
that.
you have been studying.
Well, that
Back
usually
to the
means
muscle
that's
temperature, Bob. We're
Sure.
babbling again. But that's the way we are. So the muscle or the temperature of the muscle dropped 7.7 degrees with the ice cup and only 4.1. Now that's about 40%
Right.
more deep cryotherapy with this. So this is the winner. A cold,
That's the winner.
the ice massage
a
is
little
going to be the
messier to
best.
use, but easy to use.
Yeah,
and
you got to have a towel
It'd be
so the
tough
water.
to use on your back. I think, in all
Yeah,
fairness.
you get a sore shoulder.
Yeah.
Then you got to ice your shoulder.
I think it is a great one for the shoulder, a great one for the knee,
Yep.
a great one for the hip, possibly. But and the other thing, you have to have skin exposed. Where with this, you can put right over the clothing.
We did not mention that you do not want to put these directly on your skin.
Right.
You could get frostbite.
Right.
Especially if you have a cold freezer.
Yep.
So you always want to have a layer of cloth.
Especially over things like a kneecap where there's not much skin
right.
there. So.
Exactly. That's a good point. The next thing I do want to mention, Bob, is time, just to confirm
Sure.
it. Typically 15 minutes is what I've been doing for 20 years. But now in a recent study, they're saying 10 minutes is adequate.
It is. Okay.
And if you go too long, let's say you fall asleep with it on and it goes for 30 minutes, well, it doesn't
They
make
usually warm up.
they warm up, but they say if you have too much cold, then you could actually, your body can go into that hypothermia
Sure.
phase. And so if you stick at 15 on these, 5 minutes on these, you're fine. If you want to go 10 minutes on this and go more often, every hour or every 2 hours, that's a good way to treat a swelled up sore injury.
Yeah, what's nice about this is, another tool in your toolbox
Right.
to help you manage pain. If you're having chronic pain, this should be part of your day.
Right.
This should, this
Yep.
should be, you should have a cold pack that you have, maybe alternating.
Well, you have cold packs in your freezer,
Yep,
right?
yep,
Yeah,
yep.
so do I. We just keep them there all the time. If I
Yep.
have an injury, it's always there. Just like some people always take ibuprofen.
Right.
It's always in, and I use that too, but I go to this first.
Sure. And you got the peas too.
Oh, well, the peas, that's
Your mother-in-law.
that's for the mother-in-law.
All right. Thanks for watching.